and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. You may think of arthritis as an old person's disease, but kids can get it too. In fact, about 220,000 children in the U.S. are diagnosed with arthritis. That's why July is Juvenile Arthritis Awareness Month, focused on raising awareness about juvenile idiopathic arthritis, or JIA, the most common rheumatic disease in children and teens. So today we're talking about juvenile arthritis and how it's treated with Dr. Paul Rosen, Division Chief of Pediatric Rheumatology at WVU Medicine Children. Welcome, Dr. Rosen, to Live Healthy West Virginia.
Thank you for having me, Mary.
That's great to have you here. So let's start with the basics first. What is juvenile arthritis?
Juvenile arthritis is when a child less than 16 develops joints that are swollen, painful, stiff. And if this lasts for more than 6 weeks, then they most likely have juvenile arthritis.
So I think a lot of people are surprised. Kids can get arthritis.
That's right. So when we think about arthritis, like you said, we usually think of older people, maybe with osteoarthritis. And then, as you know, adults will get rheumatoid arthritis. But there are differences between adult rheumatoid arthritis and children with arthritis. A couple of them being, number one, usually most adults will have a positive blood test, like a rheumatoid factor, whereas most children with arthritis will have a normal rheumatoid factor test.
Oh.
And then the other thing is that children can get different forms of arthritis. In some forms, they have multiple joints involved. In others, they may just have one joint involved. And then another problem with arthritis is it's an autoimmune disease. And sometimes the children will have their immune system affecting their vision and their eyesight.
Oh, wow.
And this could be asymptomatic. So we bring the eye doctor involved to check them as well.
Wow. So why do children get arthritis? What causes it?
It's another one of the autoimmune diseases. So if you think about, diabetes, where your immune system attacks your pancreas, or thyroid, it's where your immune system a portion of your immune system is overactive and it's attacking your joints. And there could be some genetic or environmental factors that trigger this.
What kind of environmental factors?
With autoimmune diseases, it's a little bit unclear. There's interplay between your own genetics and also the environment. There have been studies on could diet affect it, or other exposures, but there's nothing really concrete in the environmental aspect. But with genetics, it's not a simple gene that you inherit from your mother or your father. You could have genes that give higher risk for you to get juvenile arthritis, but it's uncommon to have more than one child in the same family with juvenile arthritis.
Does arthritis in children affect them differently than it affects adults? I mean, does it progressively get worse, so they're sicker when they become adults?
One other difference with kids with arthritis is that it can go into remission. So when we see the children and diagnose them, what we do is we put them on medication for about a year, get the arthritis under control, and then we take the medication away and see if their disease is gone. So that's another difference between adult rheumatoid arthritis and pediatric arthritis.
So this is a form of rheumatoid arthritis.
Right. It's we try and describe it as not a rheumatoid arthritis in miniature. It's kind of unique. And some children will have a form of juvenile arthritis that mirrors the adult form, but there's different forms. One form has high fevers up to 104 degrees with rashes that come and go, and a lot of inflammation in the body. Like I said, another form just has maybe like a swollen knee. And then there's other kinds of arthritis, like ankylosing spondylitis, psoriatic arthritis. So when you say juvenile arthritis, it represents sort of a family of different conditions, sort of lumped into one category.
Now, is there a blood test for children? that would detect arthritis? I know you said like not rheumatoid, but any of these other kinds of arthritis?
Not really. When we see a child with chronic arthritis, we want to exclude other things. So, for example, late stage Lyme disease will give kids a big swollen knee that looks like a grapefruit. So before we diagnose them with this autoimmune condition, we want to make sure they don't have Lyme arthritis.
I didn't even know there was such a thing as Lyme arthritis.
That's right. It's usually get a swollen knee from a tick bite maybe a year later.
That long?
That's right. So you have different stages to Lyme disease, and the arthritis portion is later. So we want to make sure we're not missing Lyme disease, which, as you know, is treatable with antibiotics. But if all our testing, comes back unremarkable and the child has chronic arthritis, then we diagnose them with JIA and then start to treat them with medications that impact the immune system.
It sounds like it's very tricky to diagnose this.
Right. I mean, in some respects, you just have to know, not to rely on the blood work because, like I said, the blood work can be normal in most cases. And if the family reports that their children's joints are swollen, they're stiff, and it does present a lot of times between age 1 and 2. So a parent might notice that their child is limping, or when they go to change their diaper, they seem to be in pain from manipulating their hips, or they might notice a swollen finger. And then in the office, we do a checkup and we look at all their joints from head to toe, and we look for swelling and stiffness. And what's tricky is that not all children have a lot of pain with this. It might just be that they have swollen joints and they're playing normally. So so we rely basically on what the family tells us and also the checkup. And those things are more reliable than any blood test.
Yeah, sounds like it. So what are the most common ways to treat this kind of arthritis?
Well, certainly medications like ibuprofen or NSAIDs can help somewhat with pain and swelling, but to really put into remission and get everything under control. And the main goal here is to prevent any joint damage.
Yeah.
Because the worry is if you don't diagnose it and you don't treat it, then over time, the body keeps attacking the joints, and then you lose cartilage, which doesn't grow back, and then you're left with joint destruction. So the main goal is to prevent joint destruction and to prevent disability. That's the main issue. So the tricky part is, in order to do that, we have to lower the immune system, since the condition is an autoimmune disease.
Right. But
then that's a whole nother can of worms, because the medications can make the child more susceptible to infection. That's another consideration for the parents to decide, which direction to go.
Are most cases, are you able to catch them early enough that it doesn't get that bad, where you have like total joint damage and things like that?
Yeah, I mean, I think in most cases that we see, maybe the symptom has been going on for weeks or months, and it really takes a year or two to get into that joint destruction. I mean, occasionally we do see kids who've had arthritis for years, and they may come in already with having lost some cartilage, and that could show up on an X-ray or an MRI. So, I think in most cases we kind of find it early, but if we don't, then it could lead to more complications.
So I would imagine the earlier you find it, the more likely you are to bring it into remission?
That's right. I mean, it's definitely early diagnosis and early treatment is our safest bet to prevent any disability going forward.
Okay. So how does arthritis impact a child's growth and development? Does it hold them back, or? Yeah,
that's a great question. So, what a lot of families will report is, well, first of all, if they have pain, certainly the child will be more irritable, and they may fatigue easily. So when they're with their siblings or their peers, they may just want to rest or sort of self-limit their activity. And then again, since it's autoimmune, you have inflammation in your system. So again, that'll drain your energy. And then if it's untreated, what can happen is you could have changes in your leg length. So they may get one leg grow longer than the other.
Oh, wow.
And again, like we said, can affect the eyes. So if that's not picked up, then you can get into vision loss and complications from the eyes. So we have them go to the eye doctor regularly, even if they have no symptoms, just to make sure they don't have inflammation in the eye.
Wow. this can get very serious, can't it?
Right. If it's untreated, back, but the good part about practicing and now is that we have a lot of medications to offer. The people who trained me, the medications were very limited. I mean, the standard back in the 70s was like aspirin, which caused ulcers, and prednisone, which relieved some inflammation, but it didn't prevent the joint damage. So in that era, you would see a lot more children having to need joint replacement surgery. And as teenagers. So thankfully, we're at a time where we have a lot of medication options, and we can preserve the cartilage. And those kids will go on to play varsity sports and be active, and we don't put any restrictions on them on what they can do.
I have a sister with rheumatoid arthritis, and the one thing I know was like the medications, what works for her might not work for somebody else, and it takes a while to find what works for this particular patient. Is it the same with pediatric?
Yeah, I mean, the most common medication we use is a medication called methotrexate. And if you may know, methotrexate was used a long time ago to treat cancer in very high doses. And in the 1980s, they found if you use a very small dose of it once a week, it can treat arthritis. And it's usually effective about 70% of the time. And then if it's not working, we use some of the other medications, which are called biologics. And those biologics will block like one protein in the body. One of the issues with biologics is that they can be very expensive. And of course, the payers will weigh in on that. And then we're in this new era of biosimilars where there are more medications that have very similar efficacy and side effects to the biologics. So it's this ongoing evolution of sort of the medications and how do we best treat the patients.
Do the health insurances usually cover these medications?
Yeah, it's an ongoing, dynamic where new medications keep coming to the market. Which medications get FDA approval, and then sometimes they have FDA approval for adults but not children. So the pediatric part of it is a little bit of a complexity because if it's approved, for 18 or older, like a payer would say, oh, you can use it in the 6-year-old. So, we're always kind of keeping up of what's happening on the medication front.
Wow. You've got your hands full. You got a lot going on here. Can a child with arthritis grow up healthy?
Oh, yes, absolutely. Absolutely. So like I said, some children go into remission, and we put them on medication, get their arthritis under control, and then really the best way to find out if their arthritis is gone is to withdraw the medication and then see what happens. And in some cases, the arthritis never comes back. In other cases, the arthritis comes back right away, or maybe it comes back down the line. And then we have to put them on medication again for another trial period and then see. So there's some variability when we're talking about pediatric arthritis.
It sounds like there's a lot of hope, though. I mean, this kind of diagnosis is not like a death sentence. I know that's extreme, but
no. Yeah, I mean, the main thing we tell families is they're still going to go to school. They're still going to college. They don't have any restrictions on whatever they want to do. They can play sports. Now, certainly, if they're in pain and they're limping, we just have to get that under control, and then they can get back to their sports and their activities. But you're right. I mean, it can be, it's obviously a very serious diagnosis for a family and a child. And one of the reasons I went into this field is because I get to see the family every few months and check in and see how things are going. And when we have a child who's limping or in pain, and then we get them back to the sports field and they're thriving, like that's just really special. So.
Oh, and there's not a lot of you. Isn't there a shortage of pediatric rheumatologists?
Yeah, that's right. We're one of the smallest fields in medicine. And when we opened the practice in 2019, I was the first pediatric rheumatologist in the state of West Virginia. So yeah, I definitely feel like, I'm needed, and certainly, the families show a lot of gratitude, that we're here. So it's working here at WVU has been really rewarding.
Now, I know you mentioned a few of the complications earlier, but, what are the potential complications of this disease?
Well, like we talked about, you have to watch out for eye disease. Some children will get arthritis of their jaw or their TMJ. And if that's undiagnosed, eventually there can be joint damage in the jaw,
Oof.
which can present as like a smaller chin, and they may need jaw surgery later. So we're always checking on their jaw to make sure that's looking good. And then just in general, growth and development. If their arthritis is out of control, can definitely affect their overall growth. And like I said, they can get a limb length discrepancy. And then, we just want them to develop, normally without, pain or any joint problems.
And that can be done.
Correct, correct.
It can be done. You did mention it can be hereditary, right? Can you treat arthritis through diet?
I get a lot of questions about that. Okay, the child has arthritis. What can I do with their diet? And there's no sort of medical evidence. Well, if you follow, this diet, the arthritis will go into remission. But I often have families, ask me about different vitamins or supplements. And what I try and do is just try and make sure whatever they're doing doesn't sort of cross-react with the medications. So I use the WVU pharmacy a lot. They've been very helpful. But there's no sort of evidence like one particular diet would make this autoimmune disease go away.
Like avoiding nightshade vegetables. That's one I hear a lot about.
Right. I mean, you have adults with, let's say, gout, which is different, and they may eliminate some things. But we just want to make sure that the child has a healthy, well-rounded diet, and we don't want there to be like sort of a fad where the diet gets very restricted. So and we can always consult a nutritionist if we need to, but there's no sort of standard arthritis diet for children. Okay. So we don't really have a lot to offer in terms of the evidence there.
Okay, now here's a good question. What are growing pains? We hear about that a lot. What exactly are growing pains?
So growing pains are not all that well understood, but basically children, usually around age 3 up to age 12, typically get pains behind their knee or their calf or their thigh muscle. And they may get it at night, and it may be pretty severe where the child's crying. It looks very serious. And the family might give them some Tylenol or massage the muscle, and then the next day they're totally fine and they're playing normally. And some kids can get growing pains several nights a week, and it can be very disruptive to the family, especially if the child is screaming at night, which is different than arthritis where the joint's actually swollen and it's like that all the time. So that's
pains, not arthritis.
Correct.
That's something you can have that, but not have arthritis.
Correct. Okay. Correct. So growing pains is, again, it's not really clear why children get those, but they're typically treated with some ibuprofen, some massage, and then they after some period of time they stop having that.
Okay.
But for growing pains, we just look for any red flags. That would be fevers, back pain in a young child, a swollen joint. But if your child's healthy and they're just having some sort of leg pain that's transient and they're playing normally the next day and they have a normal exam with their doctor, that's all very reassuring.
Okay, that's good to know. What are other causes of joint pain that we don't want to confuse with arthritis?
Well, we see in our practice, we see a lot of teenagers with just sort of like body pain, joint pain, muscle pain, and even chronic fatigue. And when you look at them, their joints aren't swollen and they bend normally. And we've definitely seen this more since the pandemic. And when you do the history, you find out, maybe they're having chronic headaches, or maybe they're having stomach issues, or maybe they have insomnia. And there's a condition called fibromyalgia, which is basically defined as muscle and joint pain, sleep disorder, and fatigue. And again, it's challenging because there's not really a great test for that either. But we look at the checkup, and if we don't see anything swollen or stiff, and it's just sort of generalized pain, then we're thinking more fibromyalgia, which we think maybe the nerve's not working properly and causing body pain.
And you saw more of that during the pandemic?
Yeah, I think during the pandemic, when we had kids dropping out of sports, spending more time at home, and then maybe more video games and sedentary lifestyle.
Less active.
We see when kids lose their sports or they're not exercising, then they're more prone to get musculoskeletal pain, and maybe even headaches, especially if they're not staying hydrated. So if they get out of their normal routines, they're more prone to get some sort of like body pain.
Okay, good to know. When should a child see a pediatric rheumatologist such as yourself?
Well, certainly, if they're having joint pain and they get checked with their pediatrician or family medicine doctor, and the pain is ongoing and not getting better, then if it's been at least 6 weeks and there isn't a clear explanation, they should probably see a pediatric rheumatologist. But again, there's other things that can cause joint pain. Some children, their joints are what we call hypermobile, which means they're very bendy and they can do tricks for their class and they're double jointed. So those kids will complain of, pain with writing, pain with stairs, pain with running. And that's just because they have the opposite issue. Instead of the joints being stiff, they're extra flexible.
Okay. I used to be able to bend my thumb back.
That's right. That's one of the signs. That's right.
Not anymore, though. Well, we mentioned earlier about that there aren't a lot of pediatric rheumatologists. So can a child be evaluated through telemedicine?
Yeah. So, during the pandemic, we started seeing a lot more kids over telemedicine. And what I learned is that, number one, you could see the swollen joints on the camera, or the family could send a photo that I can enlarge. And I was actually sort of teaching the parents how to do the joint exam from their living room. And that kind of got them more involved in looking at their child's range of motion. The other lesson I learned was that it may be better to see a 2-year-old or a 3-year-old in their living room in their mother's lap, rather than throwing them in the car and then they miss their nap and then they're in a 4-hour car ride. So there is some skepticism about telemedicine. I'd say my experience from it has been pretty positive. And because of the geography and also the weather too. I mean, it's pretty common. We'll have a clinic in February and there's a snowstorm, and we just start switching those visits over to telemedicine and just keep the family at home safe. And then we could do the visit on the video. So we've done a lot of telemedicine and it's been very helpful.
Yeah, especially in a state like West Virginia.
That's right. And I always, when I first started, I would, ask, how long did you drive? And, people would say, we drove here 4 hours, 5 hours, we booked a hotel. And I would just feel bad that, they're spending all this time and money, and we could service them with a video visit or some other way that it's not so time consuming. So I think I've learned a lot about telemedicine, and then I think my patients, they like it too. And, for follow-ups or, new patients. So it's worked pretty well.
That's great. That's great. All right. So now I want you to talk a little bit about the level of expertise of the juvenile arthritis team at WVU Medicine Children's. Why patients, you don't have to leave the state for great care, right?
Right. I think when we first opened the practice, we had kids traveling, to Baltimore, Pittsburgh, Cincinnati, Cleveland, Columbus. And since then, we could just serve everyone without the travel, and especially with the telemedicine also, they don't even have to leave their home. And so we see the children, and then we rely on the other specialists here at WVU. So I often pull in consultants in pediatric physical medicine, certainly orthopedics, pediatric orthopedics, and I share a lot of patients together. We're always consulting each other. We definitely rely on the Eye Institute to help get the kids' eyes checked and treated. And if they do have inflammation in the eyes, we have expertise there. We definitely rely on physical therapy and occupational therapy.
Oh, yeah.
Because if your joints have arthritis, you could very quickly lose range of motion. So we want the kids to maintain their range, and we rely on PT and OT. And then, some children with arthritis have other issues, headaches, stomach issues. So we rely on really all the specialists around WVU.
So it's a multidisciplinary approach.
Correct.
I would imagine has to be. I mean.
Yes. And then, we also have other folks on the team. For example, the gym teacher at school, or maybe the principal, hasn't had a child with arthritis before. So we have a wonderful school counselor who can meet with the family and help whatever documentation or devise an education plan. So there's a lot of behind the scenes work. Also, the WVU pharmacy here is unbelievable. And we talked a little bit about some of the issues with these expensive medicines and getting them authorized. So I lean very heavily on the WVU pharmacy. And if I have a question, I can ask them and they get right back to me. So there's just a lot of behind the scenes folks who really support, a child with arthritis.
It's a good team, huh?
Excellent, excellent.
Well, before we go, I just want to ask you, what's the most important thing you want our viewers or listeners to know about juvenile arthritis?
Well, I would say it's an uncommon condition, but just having an awareness that kids could get arthritis and that it presents with, joint pain or swelling or dysfunction or a limp. So families should be aware, and then if they're suspicious, they should certainly see their primary care doctor, have a conversation with them. And if the pain or swelling is persisting, then the next step is to get an evaluation with a specialist.
Okay, good to know. Well, thank you so much for sharing all this information with us. I think we got a lot of questions answered today.
Very good, Mary. Thanks for having me.
Thank you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about juvenile arthritis and other children's diseases, visit wvumedicine.org/children's. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcasts or the Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Rosen and everyone at WVU Medicine, thanks for joining us.